Hi everyone. Tonight I thought I would discuss some of the options you have as a parent of a child or children with special needs. My own situation, my boys were diagnosed with 22q11.2 duplication a little over a year ago. They were diagnosed in June of 2010, and at that time I wasn't very familiar with my options as a parent of the things that I could offer or provide or figure out a way to get for my children. So one thing is therapy, if your child needs it. If not, that's great. My own children, they get speech and occupational therapy once a week. I've also recently gotten them into something called hippotherapy, which is therapeutic horseback riding, and if I mispronounce that, I apologize. Um, Something else extremely recently now that I've considered for Remington, who is 4, is something called ABA therapy, which stands for Applied Behavior Analysis. Typically, it's more well known for being used in kids with autism. Neither of my children have been diagnosed with anything on the autism spectrum. I would like to clarify that. But it's also, used for any child with a behavior issue, like major behaviors, not just, your kid throwing a fit because they don't get their way. I mean, it's for extreme, I guess, behaviors. So that's something that I'm going to probably start with him soon. Well, the ABA therapist will start with him soon, rather. But therapy is one option for your child. There are different types of therapies. There's speech, occupational, developmental, physical therapy if your child needs it. There's the therapeutic horseback riding, as I mentioned. There's ABA, and there's probably numerous other types of therapies that I'm not familiar with or may not know about. Also, as far as school goes, there is, if I don't know how your area is, but there could be a special needs or developmental therapeutic preschool. That's one thing my 4-year-old is in, and my 7-year-old is in as well. When he was of age, it goes from age 3 to 5 is how long they can be in the preschool, and then they transition out and they go to kindergarten, either a regular education kindergarten or resource or special needs assistance or something like that. Also, as far as school goes, another very big thing that you might want to look into is something called an IEP, which stands for an individual education plan. That's very important, I feel, for a kid with special needs of any kind. Basically, you would go in and speak with someone at the school, and they would set up a plan or a chart, whatever, for your child. So if your child, has difficulties or struggles with something, then it would be written in that plan, the best mode of action, I guess, for that struggle or difficulty. Like my son Adrian, for example. In his IEP, it states that due to his ADHD, he, is very fidgety and has difficulty sitting for long, extended periods of time. So I had it set up in his IEP to where it says that if the teacher notices that he starts getting a little too antsy and has difficulty focusing on what she's trying to discuss, then he can get up for, a few minutes just to have a little break. He can get up and go get a drink of water, or he can, she can give him something to take to the office, for example, just a little break, something like that. I'm also thinking of getting it implemented into his IEP to where the last 30 minutes of school, he goes to the resource room, because right now he is completely integrated into a regular education classroom. He does not go to resource or special education at all. So, but last year I noticed that as far as homework went, he really struggled with it. It was overwhelming for him. So this year I would like to get it set up to where the last 30 minutes of class he goes to resource, and that way he can have kind of some quiet time and have more, hopefully, one-on-one attention to, if need be, so he can get his homework done and not feel quite as overwhelmed with it. So, also, back to the whole therapy thing, my children have some sensory issues as well as the behavior issues. So I've learned quite a bit from the occupational therapist as far as things I can do to help them with that. One thing I highly recommend is called a sensory brush. I should have brought it in here with me. It's this little plastic brush, and you just brush their arms and legs and their back with it, and it helps them. I'm sorry, I'm not an occupational therapist, so I cannot explain a little better, but please feel free to Google any of this information if you're interested, or if you already have therapists, please ask them about this, and see what the best mode of action is for your child. Also, my children use weighted ankle weights, ankle weights. 3 pounds total, 1.5 pounds on each ankle. I just, bought them at the store for like $11, I think. And whenever they start getting too wound up or too hyped up, I have them put the weights on, and it helps kind of calm them and kind of bring them back into, where they need to be to help them focus. And also it helps with, like if your child has low muscle tone, for example. Obviously weights, them walking around with those weights on, it helps build up, strength in their legs, or you could put them on their wrists also. You could get wrist weights. Also weighted vests help. A weighted blanket. And you can purchase these online, or if you're crafty enough, you can make your own also. I'm trying to think of what else. There are so many different things. Really, there are. You have so many options. It's just a matter of finding them and, knowing about them. Like I said, when I found out a little over a year ago about my children being diagnosed, I had no idea. I was clueless. Thankfully, I'm in contact with, some people that gave me a heads up and gave me some ideas as to what to do, and they really helped lead me in the right direction. So, it's really good to find someone that kind of has a little bit of knowledge or experience, and ask questions. That's the big thing. Constantly ask questions and find out information. Look online, ask your doctors, ask therapists. Sorry, I'm stumbling over my words tonight, but yeah, just ask around. Anything you're curious about, just make sure to ask about it. That's very important. So I guess I will end this for tonight. So thank you.